Lano here, double board certified facial plastic and reconstructive surgeon. We're doing a facelift procedure in upper eyes for Sharon today. Sharon, how you feeling, dear?
Good, thank you.
Very good. So Sharon has many active years ahead of her just yet, and we did some of the Bellafill filler treatment. You can see that on our previous video. And now we are going to do some of the numbing medicine. So Sharon has had some of the local anesthesia, and here are she's had some of the numbing medicine with the fillers, just a little bit. Today we're going to be tightening her neck and jawline, so you can see here her photos from before, the neck and the jawline area. That's what we're going to be tightening up. And there you see it right there. Now, Sharon, how long have you been thinking about having something done for your neck and jawline?
Oh, 10 years.
10 years? What was it that was holding you back from having something done?
Oh, just life. So many other things.
So busy.
Yes.
So many fun things to do. Well,
yeah.
We're glad that you're here. You're going to do great. You had a chance to read through our book. Now, did you attend one of our seminars, or you just came through for a consultation?
No. Consultation.
Got it. Did you watch any of our videos online?
Yes.
What did you think about the videos that you saw?
Well, it encouraged me. That's why I'm here.
There you go.
I saw, a big difference.
Did you watch any of the actual surgeries online? Some people don't want to watch those, but some
No.
people find them helpful. That's fine. Well, if you choose, you can watch your own procedure because it'll be online. But some people say, no thanks, I don't want to watch it. But we do have people.
No,
let us know
watch.
if you're tuning in where you're coming from. We're in Tampa, Florida, and in the Villages, Florida. Thank you for joining. Thank you for sharing. So I am Dr. Rich Castellano. We're on YouTube.com/ImageLift. We're on Facebook.com/ImageLift. And we're on Periscope. Ireland.tv/ImageLift. Hello from Ireland. Thanks for joining in, and thank you for the shares. We will be rebroadcasting, so make sure that you are following. Now I'm going to do some marking on the skin. And Charlene, you may need to help us with the camera angle because I'm going to raise things up just a little bit. If you can just tilt the camera. So we're going to raise it up so then she's going to come out of focus. Okay, if you could just tilt the cameras up a little. That's good. Thank you so much. Perfect. Hello, Chastity. Thanks for tuning in. We want to center her face. That's good. And the same one on the top. And thank you to Charlene and Nina for doing such a great job setting everything. Now I'm going to turn your chin up just a little bit here. And I'm just drawing on the skin. There's a natural skin crease that we all have. And when you place the incision right in that area, it's very difficult to see. I use 1% lidocaine with 1 to 100,000 epinephrine. And so you'll feel a little pinch here. 1, 2, 3, pinch. Sharon, was that a little pinch? Medium, big?
Big.
Bigger? Okay, we'll go slowly, nice and easy. We're not in a hurry. Always fast, but never hurry. And you'll feel that ease up just a little bit. So what we do is once we do the numbing medicine, then Sharon really can't feel what we're doing. I'll let that settle in just a bit. Thank you for the hearts and the shares. We've had hundreds of thousands of views all around the world. You feel a little pinch here, Sharon? Very good. So I am a facial plastic and reconstructive surgeon. You feel a little pinch here. We're going to be presenting in Las Vegas a couple of times this summer, and then feel a little pinch there. We'll be presenting in Phoenix and in Miami later this year. We also have a presentation out in Chicago soon. Now I use the tumescent solution. So the tumescent solution is a numbing agent. We use this as a spinal needle to help place the medicine under the skin. You feel a little bit of a pinch here, Sharon? Not too bad? Sharon, you feel a little pinch there?
Yes.
Now is it small, medium, big pinch you feel?
It's a medium.
So we'll go slow. We're not in a hurry. So this is just the numbing medicine. How about here, a little pinch there? Not too bad?
Not too bad.
Very good. So we will make sure that Sharon is comfortable. Sharon, where are you from originally, dear?
Michigan.
You're missing out on all that cold weather.
I'm loving it.
We're also going to be doing some of the laser lipolysis with her lift, so you feel a little pressure, a little pinch here. Feel a little pinch there? Not too bad?
No, that's not bad.
Everything's looking good. Sharon did have some of the relaxing medicine, so she feels pretty relaxed. If we need to give her more, we can. We use a local anesthesia. We also use the vocal anesthesia. When you're talking to people, it makes them feel relaxed and comfortable, and they hear me describing what I'm doing, and it helps to make us feel good. We monitor heart rate, we monitor oxygen and pulse ox, we monitor blood pressure. We will be rebroadcasting later, so make sure that you are following on periscope.tv/ImageLift, Facebook, and on YouTube. Everything's looking good. We also do have a contest. If you want to win a free syringe of Bellafill, you register on our Facebook page, post a picture of yourself and why you want to win, and just follow us on Facebook and YouTube, and you're enrolled in the contest where you may win a free syringe. We inject it on daytime on TV. You feel a little pinch there, Sharon?
Little.
Okay, good. Everything's looking good. Thank you for the hearts. Thank you for the shares. We will be rebroadcasting in a little bit, so make sure you are following us. And put your alerts on Periscope, so that way when we broadcast, you get an alert that we are live. So for the doctors and students that are watching, the tumescent solution is used commonly for liposuction, but it works great for facelifts as well. The epinephrine inside the tumescent helps to minimize the bleeding because the blood vessels shrink and get smaller. Everything's looking good. Thank you for the hearts and thank you for the shares. No sound on Facebook. Thank you. All right, the connection is weak. We may just have to restart that connection. That happens on Facebook when the connection is low. Thank you for the message. Appreciate that. So we're better off on Periscope because the sound and the connection not as strong for Facebook. Everything's looking good. So you feel that getting a little bit more numb there, Sharon?
Yes.
Okay, good. So you just numb little by little by little, and then before you know it, we're done with the numbing, and then that's how we do the lift. We're doing a facelift under local anesthesia. We're doing laser lipolysis. We also did some of the Bellafill, facial filler injection, so long-term filler. The polymethyl methacrylate is not absorbed by the body. Thank you for the hearts. Please do share. Let your friends know you're watching live surgery. This is how teaching is done in the teaching institutions, where the residents and the students are looking over the attending shoulder, but you can look over our shoulder just through your cell phone plan. We have a global audience, a global network here, just through our AT&T and Verizon plan. Everything's looking good. Now we will be rebroadcasting a little bit. Pressure pinch. So thank you for following. Very good. How are you doing, Sharon?
Good.
Thank you for joining. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. You can follow us on YouTube. Check us out on Amazon. We have 2 Wall Street Journal bestsellers, The Smile Prescription and We Guarantee We Can Make You Look Younger. Today for Sharon, we're going to be doing the ImageLift facelift, and we're going to be doing laser lipolysis to tighten the skin. Feel a little pinch here?
Yes.
Everything's looking good. Thank you all for the hearts and the shares. Appreciate that. A lot of hearts and shares for Sharon. Thank you for inviting your followers, for allowing us to teach using her procedure. We will be rebroadcasting. So we've got a new address now. We're on ImageLift for Periscope instead of @Rich Castellano. Everything's looking good. So all of our names are the same. They're all ImageLift now. Facebook.com/ImageLift. I'm going to turn your head to the side, nice and easy. That's perfect. We're at periscope.tv/ImageLift. And we are at youtube.com/ImageLift. Everything's looking good. You feel a little pressure pinch here, Sharon?
Yes.
Now after the lift, there's a physical versus social downtime. Physically, we get back into our routine, errands, shopping, things around the house in a day or two. Socially, we pass the grocery store test. 7 to 10 days. You walk into the grocery, no one really does a double take. Everything's looking good. So you can see that lightening of the skin. That's from pressure of the tumescent solution, and then the epinephrine also causes that blanching. Like when you place your finger on your skin and you see the blood runs out of your tissues, well, the epinephrine causes that, and that helps the medicine. You feel a little pinch there. Helps the medicine to stay in the area longer, and it reduces the size of the blood vessels so that there's less bleeding, which is desirable for procedures. This is an office-based procedure, and that's what patients want today. They don't want to go to a hospital. They don't want to go to a surgery center if they can avoid that. Everything's looking good. Now we will be rebroadcasting, so make sure you are following. Thank you for inviting your followers, and let your friends know they're going to want to know you are watching live surgery. This is live, no filters, no editing. I'm the only facial plastic surgeon that I'm aware of that does regular live broadcasts of facelifts on awake patients, so you can hear their response and ask them questions and see that you don't need general anesthesia for these types of procedures. This is safer, less risk, and less expense. Why do we do these types of treatments? People do treat us differently. A little pinch there.
Someone said they wish they could afford this.
You'd be surprised how affordable it can be. The best is to have a consultation, and then you can find out what your options are. But people do treat us differently based on how young or how old. Can you switch this for me, please? They think we are, and I'm going to turn your head all the way to the side. There you go. They think we are, and people treat us differently based on how much or how little we smile. The most important person who treats us differently based on our appearance is ourself. When we like how we look in the mirror, it lifts us up. It builds our confidence. It gives a little pep in our step. But if we look in the mirror and we feel like we don't reflect who we are on the inside, it can bring us down. So this is one of the best investments you'll make in yourself when you want to look younger. If you want to look more attractive, you just have to smile. And if you want to look younger than what we can achieve with the cosmetic treatments, then you just have to act immature. Sharon, how you doing there?
Good.
Hi, Cheryl. Thanks for joining in. Good to see you. Everything's looking good. We will be rebroadcasting, so make sure that you are following periscope.tv/ImageLift. Facebook connection. It looks like Facebook may not be having audio, and we'll rebroadcast that connection here in just a moment. Pressure pinch. Everything's looking good. Sharon, are you feeling any pain at all, dear?
No.
So we're just doing the numbing medicine here. Pressure pinch, pressure pinch. Everything's looking good.
We're gonna redo that in a minute.
We're going to rebroadcast in just a bit. I'm still going to do a little bit more numbing. I'm going to do some of the... Thank you for joining. Thank you for the hearts. Thank you for the shares. Hello, Mehmet. As in Mehmet Oz, thank you for joining. Very good. Sharon, I'm going to turn your head all the way to the middle, and I'm going to turn your head all the way up to the... That's perfect, just like that. Thank you for joining. For those of you just joining in, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We are proud to help teach doctors bedside manner. We are working with hospital executives to help spread our philosophy and our training and strategies to increase patient reviews. Do you feel a little pinch here, Sharon?
No, it's good right there.
You feel a little pinch, you might feel a little pinch here. They are proven effective strategies, and in today's world, hospitals are requiring Press-Ganey scores to show how patient satisfaction is, so that's where we do our best, is helping show how to make patients smile more. Let me turn your head to the right. That's perfect. Now I'm going to draw on the skin. Everything's looking good.
Good.
So Sharon's you're gonna catch up on some movies while you're relaxing
Yes.
at home?
Was that all numbing medicine?
That's numbing medicine, that's correct. So these are the areas I'm gonna lift in the skin, and then I'm gonna do some additional numbing across the incision location. We will be rebroadcasting in a little bit. Little pinch here, that's a pinch over here. Little pinch. Pinch. Little pinch. Sharon, you feel a little bit of a pinch here?
Yes.
Come on, count. Everything's looking good. So the lidocaine, for the medical students watching, that blocks the sodium-potassium pump for the nerves and allows that area to be numb. And the numbness lasts for about an hour or two after we're done with the procedure. Everything's looking good. Thank you for the comments. Thank you for the questions. Look us up at ImageLift.com. You can also look us up on Amazon, our 2 Wall Street Journal bestsellers. Feel a little pinch here. Feel a little pinch, or not too bad? Little pinch? Little pinch there. Now I can usually tell when people feel a little bit of the pinch because I see any slight facial expression, I see the little tiny wincing, because right now she may feel very little or nothing, but then she feels a little stimulation, and then I can see that straight away. Sorry, a little pinch there. How about here, little pinch? Little
Not
pinch there?
bad.
Okay. Now here you'll feel a little pinching. Pinch over there. Little pinch here. Not too bad.
Not too bad.
Everything's looking good. Little pinch.
Yeah, that's
a tender area. How about here, pinch? Feel a little bit of pinching here. Now I'm going to draw on the eyelids, and we will be rebroadcasting in a little bit, so just make sure that you're following. Now, I draw on the eyelids, I mark out the crease. And then I use the ruler.
How long will the scars take to heal?
So there's physical versus social downtime. And physically, people get back into their routine in a day or two. Socially, we pass the grocery store test 7 to 10 days. The scar tissue matures over a period of a year, but it's not visible for those things that you're seeing. So scar tissue continues to change over time. Thank you very much for that question. Smooth. Now that I marked the bottom portion, then I use these smooth forceps to show how much we can pinch that her skin is still that you can see the eyes are still closed even when I'm pinching some of the skin. And then I test it. Cut one.